Look down at your feet right now. Really look. Because your feet might be the first part of your body trying to warn you that something is wrong, long before a blood test ever catches it. Doctors call it a silent condition for a reason. It can build for years without a single obvious symptom. But the feet are often where it shows up first, because they are the farthest point from your heart and the most vulnerable to nerve and circulation damage. In the next few minutes, I am going to walk you through 9 specific warning signs your feet can show you, and number 7 is the one that gets mistaken for a completely different problem almost every single time, which means people treat the wrong thing for months while the real issue keeps getting worse. If you or someone you love is over 40, carries extra weight, or has a family history of diabetes, do not look away from this one. Hey, welcome back. This channel is about breaking down real health warning signs in plain language. The kind of information that actually helps you catch something early instead of after it becomes a crisis. Today we are focused on the feet, and here is why that matters so much when it comes to diabetes specifically. High blood sugar levels, sustained over months and years, do 2 things that hit your feet especially hard. First, they damage small blood vessels, which reduces circulation to your extremities, meaning your feet get less oxygen and fewer nutrients than they need. Second, they damage nerves, a condition called neuropathy, which can dull sensation so gradually that you barely notice it happening. Put those 2 things together, poor circulation and reduced feeling, and you get a part of the body that can be injured without you knowing it, and heal slowly even after you do know it. That combination is exactly why foot symptoms are one of the most important early signals doctors look for. So let us go through all 9, one at a time, and I will explain the actual mechanism behind each one so you understand not just what to look for, but why it happens. The first warning sign is numbness or tingling, sometimes described as a pins and needles feeling, usually starting in the toes and gradually working up the foot. This is one of the earliest and most common signs of peripheral neuropathy, which is nerve damage caused by prolonged high blood sugar. It typically develops slowly and symmetrically, meaning it tends to affect both feet at roughly the same time and to a similar degree, which is actually one of the clues that separates it from other causes of foot numbness. People often describe it as feeling like they are wearing an invisible sock or like their foot has gone slightly numb after sitting the wrong way, except it does not go away. The second sign is a burning or shooting pain in the feet, especially at night. This might sound like the opposite of numbness, and in a way it is, because nerve damage does not always mean less sensation. Sometimes it means the nerves misfire and send pain signals when there is no actual injury present. This is called neuropathic pain, and it is notoriously worse at night, partly because there are fewer distractions and partly because circulation patterns shift slightly when you are lying down. If you find yourself unable to sleep because of a burning sensation in your feet that has no clear cause, like an injury or an infection, that is worth paying attention to. The third sign is wounds or cuts that are slow to heal. This one is critical, and it is directly tied to that circulation damage I mentioned earlier. Normally, a small cut or blister heals within a week or 2, but when blood flow to the feet is reduced, healing slows dramatically because your body cannot deliver the oxygen, white blood cells, and nutrients needed to repair the tissue efficiently. Combine that with nerve damage, and you get a dangerous pattern, a small wound that you might not even feel, taking weeks to heal instead of days, sometimes getting worse before it gets better. This is one of the leading reasons doctors ask diabetic patients to check their feet daily, because a wound that goes unnoticed and untreated can escalate quickly. The fourth sign is changes in skin color, particularly a bluish, purplish, or unusually pale tone, especially in the toes. This is a direct visual sign of poor circulation. When blood flow is restricted, the skin does not get enough oxygenated blood to maintain its normal color, and the tissue can start to look discolored, sometimes described as a dusky appearance. If you compare your feet in good lighting and notice one looks distinctly different in color from the other, or both look unusually pale or bluish compared to how they used to look, that is a circulation-related warning sign worth mentioning to a doctor. The fifth sign is skin that is unusually dry, cracked, or flaky, particularly around the heels. Nerve damage does not just affect sensation, it can also affect the nerves that control sweat glands. And when those nerves are impaired, your feet may stop producing the natural moisture that keeps skin supple. The result is skin that becomes dry and prone to cracking, and cracked skin creates an entry point for bacteria, which brings its own risk of infection, especially layered on top of already reduced healing capacity. The sixth sign is swelling in the feet or ankles that does not have an obvious cause, like an injury or a long day of standing. Persistent swelling can be related to circulation issues or, in some cases, to how the body is managing fluid balance when blood sugar levels are consistently elevated. It is not exclusively a diabetes symptom. Plenty of things cause foot swelling, but when it happens repeatedly without a clear reason, it is one more data point worth tracking rather than dismissing. The seventh sign, the one I mentioned at the beginning, is recurring fungal infections, particularly athlete's foot or fungal toenail infections that keep coming back, no matter what you do. Here is why this gets misdiagnosed so often. People treat it purely as a hygiene or footwear issue, buying new socks, switching shoes, using over-the-counter antifungal creams, and it keeps returning anyway. What often gets missed is that elevated blood sugar creates an environment that literally feeds fungal and bacterial growth. Sugar is a food source for these organisms, and reduced circulation makes it harder for your immune system to fully clear the infection once it takes hold. So, instead of a hygiene problem, it can actually be a blood sugar problem, wearing a hygiene problem's disguise. If fungal infections on your feet keep returning despite consistent treatment, that pattern itself is a signal worth raising with a doctor, not just a dermatologist. The eighth sign is a noticeable change in the shape of the foot, such as the arch flattening, the foot appearing wider, or an unusual bump developing on the bottom of the foot. This can be a sign of a more advanced condition called Charcot foot, where nerve damage has progressed to the point that a person cannot feel small fractures or joint damage happening in the bones of the foot, and continues walking on it, which gradually changes the foot's structure over time. It sounds alarming, and it can be serious, but it also underscores exactly why the earlier signs on this list matter so much. Catching neuropathy early, before it progresses this far, is what prevents this kind of structural damage in the first place. The ninth and final sign is hair loss on the feet, toes, and lower legs. This is one people almost never associate with diabetes, but it is a recognized indicator of reduced blood flow. Hair follicles need a consistent blood supply to function, and when circulation to the lower extremities declines, hair growth in that area can slow down or stop entirely. If you notice the hair on your lower legs and feet has thinned out or disappeared compared to years past, and it is not explained by anything else, it is worth mentioning during a checkup. Now, I want to be very direct about something. This video is meant to help you recognize patterns worth paying attention to. It is not a diagnostic tool, and I am not a substitute for an actual medical evaluation. Several of these 9 signs overlap with other conditions that have nothing to do with diabetes, things like poor footwear, other circulatory conditions, vitamin deficiencies, or simple aging. The value of this list is not that any single sign proves anything on its own. It is that noticing 2 or 3 of these together, especially numbness combined with slow healing or recurring infections, is a strong enough pattern that it deserves an actual conversation with a doctor and, ideally, a simple blood sugar test. That test is inexpensive, quick, and it is one of the most useful pieces of information you can get about your long-term health. If you already have a diabetes diagnosis, these same 9 signs matter just as much, maybe more, because they can indicate that your blood sugar management needs adjusting or that it is time for a more thorough foot exam with your doctor. Daily foot checks, well-fitting shoes, and prompt attention to any cuts or blisters are not overly cautious habits. They are exactly the kind of routine that prevents small issues from becoming serious ones. And if you do not have a diagnosis but recognized yourself in several of these signs while watching, please do not just close this video and move on with your day. Book the appointment. A finger prick blood sugar test takes about 60 seconds, and it could be the single most useful thing you do for your health this month. If this video helped you understand your body a little better, subscribe, because I put out a new video like this every week, breaking down real symptoms and what they actually mean, without the fear-mongering and without oversimplifying it either. Leave a comment and tell me which of these 9 signs surprised you the most. I read every comment, and I am always curious which ones people had never heard connected to diabetes before. And if you know someone whose feet have been giving them trouble for a while, and they keep brushing it off, send them this video. It might be exactly the nudge they need to finally get it checked. Thanks for watching, take care of yourself, and I will see you in the next one.